Hello, this is Dr. Mosquera. You already have your surgical gum graft, and I'm going to explain a couple of things that you should not do after the procedure. The first rule is do not pull the lip. I know you are curious to know how it looks like, if we were able to accomplish what you want, but please do not pull the lip. That is going to rip the stitches and is going to make the graft to fail. Rule number 2, do not rinse with mouthwash. I'm talking about the regular use of mouthwash with movement. That is a no. You are going to clean that area with Q-tips. So any type of mouthwash like Listerine or scrub or salt water whatsoever. Rule number 3, do not eat crunchy food. I'm talking about popcorn, Doritos, granola, chips. None of those things can be taken because it's going to damage the graft. Rule number 4, avoid food that is hot. No hot coffee, everything has to be cold. When you eat something that is hot, it's going to make you bleed more. Rule number 5, no exercise. This is not the time for doing exercise, doing a walk, running a marathon. Every single time that you do exercise is going to increase your chances to get some bleeding. Thank you. Hello, this is Dr. Mosquera, and we are going to talk about what to do after your surgical procedure, especially gum grafting. So please, the first rule is that you need to take your medications as we explain it to you. Most of the pain and discomfort comes from inflammation. So you need to keep your medications, anti-inflammatories, all the time. In that way, you have less discomfort. The second rule is please take through the day after the procedure small sips of iced tea. Iced tea contains tannic acid. It reduces bleeding, it reduces inflammation. I want the tea to be touching the surgical areas. If you get tired of sipping iced tea, you can switch it for dipping the tea bags in cold water, squeeze the water, and then you place the tea bag in the area that is bleeding and you bite down. You can do that on and off for 20 minutes. Please avoid rinsing and switching. The third rule is please use the stent. You most probably were given a stent to use on the top part of your mouth. The purpose of the stent is to protect the blood clot that you have in there. When you rinse, you will remove the blood clot. So that stent will protect the blood clot. Use the stent for the next 24 to 48 hours. If you want to refresh your mouth, it's okay to remove it, clean your teeth, and put the stent back on. When you remove the stent, a small blood clot may come out. Please don't panic, that's normal. You can put the blood clot in the stent and reposition it. The fourth rule is please clean the area of the surgical graft. In this case, you have a lot of stitches in there. You have to take a Q-tip. You can dip it in the mouthwash or the AO gel provided and gently clean around this area. Try not to pull the lid while you're doing that. When you clean the area, it's going to remove all the bacteria and food debris that they can be trapped in there. And the last one is please avoid pulling the lip. I think we already talked about that. I stress a lot. Please do avoid pulling the lip because that's going to make the graft to move. Thank you so much.